My name is Ellie Teloar and I'm a PhD candidate in the area of surgical specialties, and I'm mainly based at the Queen Elizabeth Hospital. Every day, doctors meet in the morning and they then visit each patient in their care. And the point of this is for them to kind of get an understanding of how the patients are progressing and also give the patient time to ask questions or figure out what's going on with their care. One of the most important parts of the surgical ward round is actually the documentation of what's going on. So there might be 15 different team members that are coming in and speaking to the patient and all talking about different things that are happening. And there's one intern, the most junior member of the team, that's tasked with documenting all of these things. And this might be to call a rehab centre and see if there's a bed available. This might be to chase bloods or book them for an operation, or it might be to tell the nurses to discharge the patient. Because these ward rounds are often so rushed and so chaotic, and maybe there's too many people involved, often this documentation is lacking. And we actually did a study and we found that nearly a third of the important conversation that's had is not documented. If we think about the patient's case notes as their blueprint for their stay, if a third of the important conversations it's had is not documented, this means that if another clinician or another team member is coming to look at their notes to see how the patient's progressing, a third of it's missing. So what it looks like is delayed discharge, or it's patient complications because something's not upgraded or something's not occurring when it's meant to. What we have done is we've taken a concept called the sterile cockpit from the aviation industry. And aviation and surgery are kind of analogous in the way that one error can be disastrous. So we have implemented something called the sterile cockpit, where we basically are telling surgeons and the different team members to focus on only essential activities, which means one person speaking at once, not multiple conversations, trying to eliminate picking up phone calls, making sure that the plan is repeated back to the team and that the intern or whoever's scribing the document is actually getting everything that's written down. We also know that by focusing on only the essential activities in the ward round and ensuring that people aren't speaking over the patient, that the patient will feel more involved with their care. So we're also going to be testing for their perceptions of the ward round before and after that. And if it is successful, then we anticipate that this is something we're going to try and get into practice, definitely here at this hospital and also in other hospitals in South Australia. If we can improve the doctor-patient relationship, we'll be seeing patients feeling a lot more comfortable speaking about how they're feeling, how they're progressing, asking questions. And what this means is that they have a better relationship to actually adhere to follow-up and adhere to advice from their surgeon. And ultimately, the goal of this sterile cockpit is to get patients home earlier, reduce complications, and overall have patients have a better experience in hospitals.